Hi, I'm Sarah Ozel Shore, and on April 24th, 2026, I will be running the Clinical Effectiveness Intensive, Timing, Readiness, and Ethical Decision Making for Clinicians. I want to begin by naming something I see repeatedly in clinical practice. Many clinicians are thoughtful, well trained, and genuinely committed to doing good work, yet still find themselves uncertain about when to intervene, when to slow down, and when restraint is actually the most ethical clinical action. This uncertainty often shows up as pressure to do something, offer an interpretation, validate more strongly, redirect the session, even when you're not fully clear that the timing is right. The problem that this training intensive is seeking to solve is that most clinical training focuses on what to do, techniques, treatment models, interventions. Far less attention is given to when particular kinds of work are appropriate. As a result, clinicians often rely on surface indicators, engagement, insight, emotional expression, or client compliance as signals that deeper work is ready to happen. But in practice, those indicators are unreliable. In community mental health, for example, this is especially clear with mandated clients or ambivalent clients. And in private practice, it often shows up with articulate, motivated, emotionally expressive clients whose therapy feels intense, full, but also circular, without producing meaningful integration or change. So if we reframe clinical effectiveness, then this training starts from a different premise. Clinical effectiveness is not primarily a technical problem, it is a perceptual and ethical problem. Before deciding what to do, clinicians need a reliable way to assess what is actually present in the room, what the client can tolerate, engage with, and carry forward over time. Without this clarity, even well-intentioned interventions can become mistimed, compensatory, or exhausting for both client and clinician. This training focuses on strengthening clinicians' ability to assess timing and client readiness in real time. Rather than introducing new techniques or treatment models, the training offers a structured framework for determining what kind of work is possible in a given moment. This framework is organized around 6 interrelated conditions that shape readiness for therapeutic work, such as the client's ability to remain present, sustain attention, organize experience, and use language meaningfully, as well as whether therapeutic work can actually be integrated beyond the session. One of the central shifts this training invites is a redefinition of the clinician's role. Instead of understanding effectiveness primarily in terms of intervention or relational activity, the clinician's task becomes one of discernment, accurately perceiving what is present and allowing that perception to govern timing, pacing, and action. Warmth, attunement, and relationality remain important. They're prerequisites, but they are placed in service of clarity and discernment rather than as substitutes for it. The seminar integrates conceptual instruction grounded in research with guided experiential components. These experiential moments are not about emotional processing or personal disclosure. They are designed to help clinicians notice internal signals such as urgency or pressure to act as diagnostic information rather than as cues to intervene. The emphasis throughout the day is on steadiness, ethical judgment, and clinical clarity under pressure. This training is designed for practicing clinicians who already know how to work, but want greater confidence in how they decide what to do in each session. It's relevant for clinicians working in community mental health, substance abuse treatment, and private practice, and it applies across treatment models and theoretical orientations. This training provides an umbrella of discernment under which any treatment modality or theoretical orientation can do its work. But without the clinical discernment and timing piece, even the most well-designed treatments are not going to be as effective as they could be. So if this description reflects your experience, you're welcome to review the syllabus and consider whether this seminar would be useful for your private practice or your work as a clinician or a therapist in an agency or community setting. I'm Sarah Ozel-Shore. Thank you for taking the time to learn more about this work. I'd be glad to have you join us on April 24th.